One of the reasons that we see more and more gynecomastia patients is the use of hormone replacement therapy and anabolic steroids with men. Hormone replacement therapy, especially testosterone replacement therapies, became very, very popular with men. We see it as early as the late 30s and up. And again, the reason is they want to feel more masculine. They claim it gives them more energy, and therefore will take testosterone and anabolic steroids, which are testosterone analogs, have more estrogen in the body as well. So it affects the breast gland, and they see a lot of gynecomastia. So if you look at those bodybuilders, you see a lot of gynecomastia cases over there. Although they don't have a lot of fat in their body, their gland is big. What people need to know is there a difference between people who treat themselves with anabolic steroids to basically become a bodybuilder, to gain more muscle mass, and people who do testosterone replacement therapy, which is also known as TRT. A study that's been done actually shows that people with TRT don't suffer that much of gynecomastia than those who do the anabolic steroids, which have like 3 or 4 more times rates of gynecomastia compared to those with the TRT. It's because that the people who use anabolic steroids are like more aware of how they look, and they mind it more, so they look for more surgical solutions to treat their gynecomastia compared to people who just use TRT, which are usually older people, less into bodybuilding, more into the overall effects of testosterone. But it's also a matter of dosing. Patients usually use high doses. They want to gain muscle fast, and they want to gain a lot. So it's a matter of a dose. So if you are on TRT, stay on the lower side. It's also healthier. Patients who have gynecomastia, they suffer from great insecurities, even walking, being in public, wearing tight shirts. They can enjoy intimacy with their partners, and then it becomes the focus of their life and everything goes around it. And by treating it, you basically eliminate the problem so they can move on with their lives.